When it comes to finding a cure for the medical issues that concern us and the ones we love, misdiagnosis, and in some cases, misdiagnosis of what are termed emerging diseases, is more prevalent than many would care to believe. There's an emerging disease suspected of originating in the environment that is causing many of the mostly women contracting this disease to be improperly diagnosed, or for some, even told their problem is imaginary. It's known as non-tuberculous mycobacterial lung disease, or NTM, a debilitating disease which attacks the lungs of its victims, and if not properly diagnosed in the early stages, can be deadly. So what is new and evolving in the treatment of this disease? How will science solve the mystery of NTM? In order to understand the progress being made, we have to first understand the disease itself.
The non-tuberculous mycobacteria, or NTM as many people abbreviate it, are a group of environmental organisms. These are bugs that are found commonly in lakes, rivers, and streams. Is a disease that typically presents in the 5th or 6th decades. It frequently affects women more than men. And typically people present with symptoms of chronic cough. It affects the lung by changing the structure of the airways. It causes inflammation in the airways of the lung, which results in phlegm production or sputum production or frequent clearing of the throat. It typically does not involve areas outside of the lung when it has that type of presentation.
Non-tuberculous mycobacterial lung disease, or NTM, is not well known or fully understood yet. An estimated 50,000 to 90,000 people in the United States have pulmonary NTM disease at any given time, and between 12,000 and 18,000 people become infected each year. The rate of infection increases 5-fold in patients over 65 years old, presenting a growing risk as the baby boomer population ages.
So this disease typically affects women. Typically the onset of disease is in the 5th or 6th decade. And many of these women initially present with either chronic cough or more frequently initially with frequent throat clearing. Until someone gets a CT scan or a CAT scan of the chest and notices the typical kinds of changes in the airways that will lead to subsequent sampling of the sputum or phlegm that they're coughing up to look for these organisms.
So if you feel like you have a chronic cough that doesn't go away and upper respiratory tract infections that keep coming through and you're just not feeling well and just something isn't right, you should definitely go see someone. And if someone's not giving you that answer or that physician's not giving you an answer, you should continue to look for someone until you get a diagnosis, because in my situation I went 6 years going from specialists to regular physicians to different doctors to everyone you can even imagine, and we couldn't find an answer until someone suggested that I get a CT scan. So it took that many years just to get a CT scan, even though I had been in and out of ERs and the results were there. But I just think because I was young, or because maybe I just looked normal from the outside, or maybe I wasn't looking so sick maybe from the outside, but in the inside I felt awful. So I think just definitely continue to search and look for an answer, or look into NTM. If you have a chronic cough or upper respiratory tract infections, more than 2+ per year, that's more than a normal person. A chronic cough, some production, sputum production, not feeling well, achiness, it could be NTM.
Scientific data demonstrate that NTM infection can occur by exposure to organisms in the environment, such as our water or soil. Additionally, new evidence suggests other illnesses or comorbidities such as cystic fibrosis, COPD, bronchiectasis, and some treatments for rheumatoid arthritis are significant risk factors for NTM lung disease. If you or a loved one have symptoms, please check with your doctor. With NTM cases on the rise and yet so few in the medical community or public aware of its existence, the #1 priority in fighting non-tuberculous mycobacterial lung disease is awareness. For NTM Info and research, getting the word out on this disease and fighting its proliferation is a personal mission.
My initial motivation, and a lot of what keeps me interested in going, is because I love my wife Fern. I want her alive and I want her with us. We need to speak up. We need to educate. We need to educate physicians so that they know what to look for, so that people are diagnosed in a timely manner. Because if that happens, then you have better treatment outcomes. So our mission is really very simple. It's earlier diagnosis and better treatments through research and cooperation from committed patients and families, medical professionals, and the National Institutes of Health, and those that can help coordinate and support this.
Okay, so since pulmonary NTM is so underdiagnosed and misdiagnosed and nobody really knows much about it, that's why it's so critical to have someone like Philip and Fern Lietman and NTM IR. He's so passionate about this disease, and because of just one person, we've been able to get some clinical trials, and we have a long way to go, obviously, but you know, that's what I hope for the future, that we can have more research, learn more about this disease, that more physicians can learn about it, about the symptoms, about diagnosing earlier, so people have a better prognosis for the future.
We have a relatively unique laboratory. There are very few people in this country, even the world, who study the bacteria themselves. We're interested in what the bacteria do, how do they live, what kind of drugs would work against them if we were to treat an infection, how the organisms become resistant to bacteria. The lab is an essential part of management of patients who have these infections. We're responsible for growing the organisms and identifying them, so we tell the physician that some of these organisms don't cause human disease. So that would tell them not to treat. Others would tell them it's a bad organism and they need to treat. We do drug testing to tell them what drugs to use, and we use DNA fingerprinting to help us know more about where the organisms come from.
I discovered NTM IR after I was diagnosed with pulmonary NTM, and I had been given a multi-drug regimen of 5 antibiotics, 2 of which were IV through my PICC line and the rest were oral. And I had a really difficult time adjusting to the regimen. They're not a newer version of antibiotics. They're kind of an older generation, so intolerable, difficult to take, and I had a hard time adjusting. And that's when I searched online and found NTM IR and reached out to them and spoke to Philip and Fern Lietman, and they kind of guided me through how important it was to take my medicine to get through it. And they were extremely supportive. They called me, they welcomed me into their home, obviously when I started to feel a little bit better, and I started attending support groups, and from there it's just been a wonderful relationship with them and NTM IR.
To learn more about NTM Info and Research, a 501c3 not-for-profit organization, visit their website at www.ntminfo.org.